Hello everyone, my name is Nicole Green and I'll be doing my informative speech on diabetes mellitus. Now in the human body there's an organ called the pancreas, and the pancreas is responsible for secreting something called insulin. And in our body this insulin breaks down glucose so that we're able to use that glucose for energy. Now there's three different types of diabetes mellitus. There's type 1 diabetes mellitus, type 2 diabetes mellitus, and gestational diabetes. In type 1 diabetes mellitus, the body does not produce insulin at all. In type 2 diabetes mellitus, the body produces insulin, but it fails to accept it. And in gestational diabetes mellitus, this normally occurs in pregnant women, and they have a high level of blood glucose during their pregnancy. There's multiple different causes of diabetes mellitus, and these include diet, lifestyle, environmental and external factors, heredity, age, sedentary lifestyle, obesity, hypertension, and insulin resistance. The symptoms of diabetes mellitus are not very fun to deal with. These include increased hunger and thirst, tiredness, lethargy, mood changes, weight loss, visual disturbances, confusion, and tingling, pain, and numbness in the legs, hands, and feet. There's multiple ways in which diabetes mellitus can be diagnosed, and a majority of these ways basically just form around a blood glucose test. And so basically you draw blood from an individual who thinks they may have diabetes mellitus or shows symptoms of it, and this blood is then tested for whatever level of blood glucose it has. If it has high glucose in the blood, then the patient more than likely might have diabetes mellitus. You can also do a urinalysis test or look at the patient's family background and see if anyone in their family history had diabetes mellitus, because it can be it's a hereditary disease, so it can be translated through multiple different family members. The complications of diabetes mellitus are very, very intense. These include blindness, kidney disease, high blood pressure, heart disease and stroke, nervous system disease, amputation, and pregnancy complications. So even though it may not seem like a big deal if our body is not producing enough insulin, it is a really big deal, and the complications from it are really, really bad. Although diabetes mellitus can't be treated, it can be managed, and there's multiple different forms of management. These include insulin therapy, oral medications, dietary modification, exercise, pancreatic transplant, and nursing management. The most important of these is most likely insulin therapy. If our body's not producing insulin at all, or if it's not accepting it, then we need an outside source of insulin. Now there's multiple people who are at risk, in particular for diabetes mellitus. These include pregnant women, people with a family history of diabetes mellitus, overweight or obese people, elderly people, people with certain infections or diseases, and people with cardiac or circulatory problems. So in order to prevent diabetes mellitus, all we need to do is just maintain a healthy diet, exercise regularly, avoid being overweight or obese, and make sure you check with your doctor to make sure that everything is doing fine.